A lot of women rightfully worry about the changes in the shape and sizes of their bump. Doctor, what is going on? One day my bump looks big, the next minute my bump looks small. One day my bump is up, the next minute my bump is down. Kilo day, what's happening? So it is very normal in pregnancy for bumps to keep changing size. In fact, notable personalities have been dragged through the media like, are you sure she's pregnant? Are you sure she's not carrying a fake bump? Beyonce, Meghan Markle, all of them have faced extensive scrutiny as people wondered whether their bumps were real or not. Why? Because their bumps kept changing shape. So yes, a number of factors can result in bumps changing shape and changing size. Some of them are associated with pregnancy, others are not associated with pregnancy. Some of the reasons associated with pregnancy include the fetus itself, the size of the fetus, the amount of amniotic fluid in your uterus, the position of the fetus, and the number of the fetus. So of course you know that multiples will have larger bump than singleton pregnancy. So there are factors not associated with the pregnancy that can result in a changing shape and size of bump. 1, amount of food in the tummy. 2, amount of fluid in the tummy, liquid. 3, the fetus itself, we've mentioned that. 4, amount of flatus in the tummy, gas. Did you know that? Yes. 5, presence of fibroids. Of course you should know that by now. And then fat, visceral fat. These are factors that can affect the size and shape of the bump. So it's pretty normal for a bump to change shape in pregnancy. But what you want to know is the changing shape, does it have anything to do with whether baby is safe in your tummy or not? How can you know this? First trimester, your uterus is still trying to come out of the pelvis, so there's nothing to measure. From second trimester, around 20 weeks, your fundal height, that's the top of your uterus, hits your belly button area, your navel area. And so from this point, you can start measuring with a tape. We call it fundal height measurement. I've showed you before. You can start measuring with a tape to know if the pregnancy is progressing well. What is the implication of this? How do you use this to find out if your pregnancy is going well? If the bump is bigger than expected for gestational age, significantly bigger outside the range of 2 to 3 cm, and you are not carrying multiples, you don't have excess amniotic fluid, you don't have fibroids that are growing and increasing the bump size, it's not as a result of food or fluid or flatus or fats, and the bump is growing bigger than expected for gestational age, meaning that it is coming from the baby itself, it might mean that baby is bigger than expected for gestational age. And if you're planning for a vaginal birth, you might want to check that weight before it runs away from you and interferes with your ability to push vaginally. What if the bump is smaller than expected for gestational age? This is the cocoa. This is the real cocoa when it comes to pregnancy safeguard. If your bump is significantly smaller than expected for gestational age, run. Usain Bolt, run. Anywhere you can get an intervention to identify the cause and correct it, be very quick. Otherwise, if care is not taken, that pregnancy may shut down before it gets to the destination, which we don't want. So somebody will say, doctor, but I'm in first trimester there's no bump. How do I know? Use your abdominal ultrasound scan results. They will typically write a number for you and say, oh, fetus is 6 weeks, fetus is 7 weeks, fetus is 5 weeks. Does it correspond to the actual age of the child in weeks? If the baby is 6 weeks, you want to see that the number that is written for you is within the range of 6 weeks. If it is less than expected gestational age by up to a week, again, run. Anyhow, anywhere and any way you know to stage an intervention to save that pregnancy, do so, because that's a very strong sign that if you don't do something fast, that pregnancy might be on the way, and Otilo, that's it. So yes, bumps change shape. Yes, bumps change size, but if you know what to look for, if you know what to track, you can know if that pregnancy is progressing well, and if the bump changing shape and changing size is a temporary thing, or if it is an indication that you should move very fast so that you can save the life of your baby. This is how we have been doing and guiding thousands and thousands of women in the birth safe program to ensure that they don't run into trouble and complications with their pregnancies by identifying ahead. No, this number is right. No, this number is wrong. No, this one means looming danger ahead. No, this one means that it's safe. It's very important so that you can safeguard that pregnancy. Looking for a platform, you're looking for a program that can break down these pregnancy numbers and show you exactly what is going in your pregnancy so that you know that you and baby are safe. Have a manner. Click the link in bio to join the program and get started. I hope this was helpful. I am Blomikis. You're welcome.